Is your lower lip constantly dry, cracked, or scaly, no matter how much you moisturize? You're not alone. That relentless discomfort may be more than just chapped lips. There's a reason your lips seem to face the brunt of sun damage, and today, we're uncovering why. Let's explore what actinic cheilitis is, what causes it, how you can recognize it, and most importantly, what you can do to protect yourself. What is actinic cheilitis? Actinic cheilitis, sometimes called sailor's lip or farmer's lip, is a condition caused by chronic sun exposure. You might notice dryness, thickening, and tenderness along the border of your lips, especially the lower lip. These symptoms can be warning signs that your lips have suffered damage from years of ultraviolet, UV, radiation exposure. But here's the thing, while actinic cheilitis itself isn't necessarily dangerous, it raises the risk of developing something far more serious, skin cancer. Why do my lips get damaged? Your lips are far more delicate than the rest of your skin. The lip's outermost layer, known as the epithelium, is thinner and less pigmented, making it more vulnerable to UV damage. When exposed to sunlight over a long period, this sensitive layer can start to break down, leading to actinic cheilitis. And here's the catch, while other areas of our skin may tan or burn, our lips don't always show those clear signs, leaving many people unaware that they're causing long-term damage. Spotting the signs. If you spend a lot of time outside or work under the sun, be on the lookout for these symptoms on your lips. Persistent dryness, scaly plaques or white patches, skin that feels tight, wrinkled, or cracked, more defined lip lines and folds, redness or inflammation patches that seem to lose the boundary between your lips and the surrounding skin. These signs usually show up on the lower lip, which faces the sun more directly. They can start as mild discomfort, but ignoring them over time increases the risk of the cells in your lip tissue mutating. It's a slow-moving threat that, if left unchecked, can lead to skin cancer. What puts you at risk? Actinic cheilitis is more common in adult men who spend time outdoors. But gender alone isn't the only risk factor. If you're fair-skinned, spend time in sunnier tropical climates, or have a job that keeps you outside, your chances of developing actinic cheilitis rise significantly. A few other common risk factors include: 1. Severe sunburn. Any history of bad sunburns can heighten the risk. 2. Age. Chronic sun exposure accumulates over years, so older adults are more susceptible. 3. Lifestyle choices. Smoking and excessive alcohol use can weaken lip tissue, increasing vulnerability to UV damage. 4. Compromised immune system. Medications or conditions that weaken the immune system can make it harder for your body to repair sun damage. 5. HPV, the virus responsible for warts, can also be a contributing factor to actinic cheilitis. If you recognize yourself in any of these descriptions, it may be time to start taking extra precautions to protect your lips. The consequences of ignoring actinic cheilitis. Most of us think of skin cancer as something that might happen on our face, neck, or arms, but the lips? Unfortunately, yes. Actinic cheilitis is considered a precancerous condition, meaning it increases the risk of developing squamous cell carcinoma, a type of skin cancer, down the line. The mutated cells in actinic cheilitis are abnormal, which makes them more prone to becoming cancerous. While only 10 to 20% of cases may develop into cancer over time, it's a risk that can be avoided. Treatment options. When it comes to treating actinic cheilitis, the best first step is seeing a dermatologist. They'll likely take a biopsy to confirm the condition and ensure that no cancerous cells have started to form. For mild cases, the treatment might be as simple as improving your daily routine with sun protection and moisturizers. Chronic or severe cases may need more advanced options, such as 1. Laser ablation, remove sun-damaged skin layers. 2. Cryotherapy, freezes the damaged patches to encourage healthy tissue growth. 3. Vermilionectomy, surgically removes the outer lip layer. 4. Electrocautery, uses heat to remove abnormal tissue. While the term surgery might sound intimidating, the procedures are often straightforward and can dramatically improve the health of your lips. Prevention. Protect your lips now. The best way to handle actinic cheilitis is to avoid getting it in the first place. Here's how you can protect yourself. Daily sunscreen. Your lips need sunscreen too. Use lip balms that include SPF and apply them often, especially on sunny days. Wear hats and sunglasses. The more you can shade your face, the better. Stay hydrated. Lips dry out faster than skin, so drink plenty of water. Limit tobacco and alcohol use. These can weaken your lips, making them more susceptible to sun damage. Avoid tanning beds. Just like the sun, these emit UV rays that can damage your lips. If you're on medications that thin the skin or weaken the immune system, use extra caution in the sun. Taking small steps now can make a big difference in your lip health later. Final thoughts? Actinic cheilitis may seem like just another name for sun damage, but it's more than that. By knowing the signs, understanding the risks, and taking steps to protect your lips, you can prevent this condition from developing into something more serious. And remember, it's never too late to start taking care of your lips. Let your next adventure under the sun be a safe one.